Before we dive into the first segment on addiction, we want to acknowledge that this topic can be difficult for some listeners. If you find it triggering, feel free to skip ahead to 41 minutes and 30 seconds to hear our Spoonie story of the episode, Lauren's journey with Conradi-Hunermann Syndrome. Your well-being matters, so take care of yourself as you listen. Hi, and welcome to Spoonful of Strength. I'm Rachel, and I live with multiple sclerosis, type 1 diabetes, and a few other diagnoses that keep life interesting.
And I'm Tina. I am a fibromyalgia warrior with chronic back issues and a proud stage 4 cancer survivor. We're sisters, and together we're here to support, inspire, and connect. So if you're new here, the Spoon Theory explains how we navigate life with limited energy or spoons.
And we're thrilled to share that we've been ranked number 30 on FeedSpot's Top 100 Chronic Illness podcast list. So grab a spoon and let's dig into stories, tips, and a whole lot of strength.
Welcome to this week's episode of Spoonful of Strength, where we have a former guest of our podcast. Bill is joining us today to talk about addiction. And then after we are finished with Bill, we will welcome Lauren in, and she's going to be talking about her Conradi-Hunermann Syndrome.
Tina, how you been doing this last week?
It was a busy weekend for us, or for me, I should say, but so I'm a little tired. So this weekend, as some of our listeners, if you've been listening to us for a while, you know I do a dog sport called flyball. This was the first year ever that they hosted a tournament in conjunction with the Westminster Dog Show. So I was up in New York City this weekend running and playing flyball, and it's a pretty big thing for it to have come to Westminster. So if you happen to follow the Westminster Dog Show, you may see some clips of me and Yogi. If you see any clips for Scallywags, which is we're in black shirts with black and orange shirts, so you'll get glimpses of me and my really big boy. Yeah, so I'm kind of in recovery today. We drove home yesterday. And yesterday I didn't feel too terribly bad, but I think I was also kind of riding that adrenaline high from the weekend, where today has been a little more, I need to get up and actually try to be a functional human being today. And that's been tough.
This will be a hard episode. I'm right there with you. It's like it's almost 1:00, and I will admit I am still in my PJs because I've just been dragging today and had a busier weekend. And so I'm like, okay, I've got an important, some things on the books for tomorrow. So today I'm going to try and recharge. And tomorrow I've got my appointment. For those of you who listened to last week's episode, I am getting a muscle biopsy done. And so I have an appointment tomorrow with the surgeon, and I'll find out where they're going to take the muscle from, and probably they'll schedule it at that time. So, well, let's reintroduce Bill into the podcast. So welcome back, Bill. It's nice to have you back with us. We really enjoyed having you on last season, so we had to bring you back this season. How are you doing?
Good. I really appreciate it. A great time last time. So it's an absolute pleasure to be back with you guys to kind of continue the story and share a little bit more about, some of the things that I've had the pleasure and been blessed to experience. Just kind of recap a little bit. It was neurosarcoidosis, which is an an inflammatory disease of my central nervous system, which impacted the right side of my body. Since getting back from LA, this is just a year. It was just a year, like a couple weeks ago. January 16th was my last craniotomy surgery, and I think January 22nd, 23rd is when I got back from LA. So just celebrated a year getting back, and just couldn't be more grateful for the life I have now.
So you're joining us today. We're to talk about addiction. So share with our listeners where advocacy for addiction has come from.
Yeah, I grew up in your typical, good family, two little brothers, younger sister, loving parents still together. Was an athlete. My oldest brothers were good athletes, and I kind of followed in their footsteps. They were kind of my role models growing up. So everything on paper, growing up was good. Uh, I had success on the athletic fields. So that was, kind of the personality, the MO that I had. I got to go to college to play a sport. I played lacrosse at the University of Maryland. And while I was there, I had success there, individually and as a team. And when I ended up going professional and playing professional ball and through some injuries. I would like to blame it on the injuries, but to be honest with you, that's not my what I will blame it on, because that's not the reality of the situation. I just enjoyed the party lifestyle. And you know, being a professional athlete enabled me to kind of live that lifestyle as well. And really, when I moved back to my hometown, I ended up getting traded to my hometown of Philadelphia. I played for, a professional team in that, in my home city. And when I got there, I ran into some old buddies, and they were the ones that kind of introduced me to opiates. So that was the crux, my main vice that got me into recovery. I developed a pretty strong opiate addiction. But some guys that I ran into in my hometown, they offered me some. I took it, not thinking anything too much about it, and I really enjoyed it. Was took a few of those, had a few drinks, and just really had a good time. And again, didn't think too much of it. Never would have thought it would have lead to anything more serious, and eventually it did. I ended up, run into those old friends a few more times. Same thing happened. Then I started to seek it out a little bit, reaching out to them, to try to get them again. And, that eventually led into, more common and became an everyday habit. And then my tolerance started to build. And that just what kind of led me into my full-blown addiction, which it got pretty intense, pretty severe, pretty quickly. And that was kind of the start of my addiction journey. Was just being in my hometown and bringing me with me. That's just who I am, and I think it was inevitable that something was going to happen like this. So it does run in my family a little bit, not my personal addiction, but there are some other addictions in my family, so it is a little hereditary as well. But ultimately it was on me, and that's kind of how I got into, that's where I got my addiction.
What time frame are we looking at? Is this college or?
Yeah, so this happened probably 26 years old. So, I got traded back to Philadelphia at 25, 26 years old. And, so post college. And the addiction started not too long after that. I was waiting to move down in the city with some buddies on the team. And during that time is when I was running into friends from my hometown, which really introduced me to the opioids. And, that's kind of the start of it. So it was, like I said, 25, 26 years old. It went on for like a couple years, 3, 4 years. I ended up getting sober around 29 years old.
Okay. Was there a defining moment or a defining event that pushed you towards the road to recovery for that?
Yes. Well, yeah. There were a few. It wasn't just one specific moment. I'll let you know the one that I think would kind of put me over the edge. I got to the point where, my addiction was out of control. That's when I learned it's not just about willpower. Like, willpower is a very big misconception that, the same misconception that I had, about addiction is like, why can't you just stop? But willpower is definitely not enough, because the power of the drug or the alcohol or whatever you're addicted to is just much stronger than your will. And I remember there being times of, I remember specifically there'd be times of me staring in the mirror, just like talking to myself, like, dude, this is not who you are. Like, you got to stop, just stop. And literally within a half hour, I'm out the door, seeking more pills to cure the physical withdrawal that I was going through. Then there was a moment in my local high school where I got in trouble. Police were called. I was arrested. Thankfully, nothing serious. And, that was a defining moment where, it gave me the opportunity. I see it now as an opportunity, but to kind of reveal that I was doing, taking these pills and, doing things that I knew I shouldn't have been doing. So that allowed me to kind of tell my parents, that, this has been going on. And that was definitely a defining moment that allowed other people to know what I was going through. But again, that wasn't enough, because I told them I'm good. I'll take care of it. And, within a few months later, I'm right back into, the same lifestyle I was leading before. And, the real defining moment, I think, was my parents and my whole family ended up having a little intervention for me because they could see, the way I was acting, the way I was behaving, the way I was living, that something was off and I didn't have everything under control. So they had a little intervention for me where they, prompted me to go to a rehab. And fortunate, I was willing to give it a shot and go to a rehabilitation center to go and get help and enter into my recovery journey.
So you entered into a recovery facility. Is that where your sobriety started?
Yes.
Can I ask a dumb question real quick? Because
no dumb questions.
Sobriety, does that apply to drugs as well as alcohol?
Great question, actually. Because that's something that I had to, figure out on my own, like, the difference between being sober and being clean. There's a few different support groups, one specifically for drugs and one specifically for alcohol and to kind of, rehash a little bit about the lifestyle I was leading, even before the drugs. Like like I said, I like the party lifestyle. I was a drinker. I was a big drinker.
Mm-hmm. So
for me, everything starts with a drink. I didn't do I never done a drug without it starting with a drink. Anytime I've tried a new drug or anything, it was because I had been drinking at some point before taking the drugs. So for me, like being sober, being clean, whatever you want to call it, I don't care one way or another. I just found that, being sober / clean is the way I just want to live my life now.
Thank you for kind of clarifying that. So when you went into treatment, then is that where then had you had any relapses after going into treatment?
Yeah, so I went in June 3rd of 2013 and thankfully that is still my recovery date. So
great job.
A little over 11 years, going on 12 years. And through my health situations, I've been really required to take opiates, as part of, the surgeries I've been coming out of. And I remember the first time I had the surgery for my health issue and there was they had me on like a morphine drip and they were feeding me narcotics, opiates, and I was very adamant, like, do not give me any of that because I was just a little over a year in recovery. And they were like, it was non-negotiable. They're like, we're not asking you to take this. Like, you have to do this because of the condition your body's in at the moment. You need to give your body a rest. I've had multiple brain surgeries since then, and I've gone on some opiate medication for those reasons, but been very strict. And, the fear of what I've gone through and like returning back to that life has been strong enough that, I've only taken it as required. And then as soon as I'm able to get off, I would get off. So I've been very fortunate in that sense.
I can imagine the first time that after that first surgery, I imagine it was difficult to go through that, having to comply, I guess, of what they were telling your body needed.
Yeah, that was a tough one to go. That was just a tough time period in general. Just everything I was experiencing with my health. And then on top of that, them feeding me these narcotics that I have a history with. And, uh, you know, I remember when they first told me that what they were giving me, because I didn't even know what I was on. I was hooked up to all these machines and drips, and I didn't know what was going on. And when they told me what they were giving me, you know, I told the doctors and the nurses, like, do not give me that. And that's when they were telling me that really we're not asking you, right? This is something that you need to take. And, I had like a tear coming down my face because I was that scared. Like the drug had me that petrified of it, because of what I've experienced going through my addiction recovery process with it. That I was so afraid to like possibly go back to that life and, to get that desire to do it again. But I had such a strong desire and such, a mindset against doing those, that as soon as I was able to get off, I got off of them because I know where that lifestyle lead me, and it was nowhere good.
Yeah, good for you. And you may have mentioned this, but how long was what was the time frame of your addiction? How many months or years did that last before you went into treatment?
Yeah, so the very first time I tried an opiate was probably like 19 years old. I remember I got some dental work done, and they gave whatever they gave you, like hydrocodone, whatever it was. And I remember taking them and I freaking liked them. I was like, "Hey, these are awesome." I didn't abuse them. I don't remember abuse them at least. But I remember when they were out, I was like, "Oh man, that sucks." I really enjoyed those, but I didn't have access anywhere to get more. Not to say I probably would. I don't know. But that was it, and it was over. And I didn't have too many more experiences beyond that. Uh, but then when I came home, when I got traded back to Philadelphia, and I'm in my hometown, and an old friend of mine had it. That was the access that I needed. And as soon as I knew I had access, on the black market, on the streets, of somebody I knew that had them, um, that's what kind of opened the door for me, and that's what led me to, that full-blown addiction. Where, just kind of give you an idea, I started taking 5 milligrams. By the end of my addiction, by the height of my addiction, I was taking about 350 to 400 milligrams a day. And the only reason I was not taking more is because it's financially draining. I couldn't afford any more. It's, three to $500 a day in pills that I was buying, which led to a plethora of other issues, moral issues, and things that I felt forced to do because of my addiction.
Do you feel that addiction is a chronic illness?
Yeah. I believe the definition of a chronic illness is something long term that you have to constantly manage and treat. And that's something that I found in my experience with addiction. I belong to a support group, a recovery program, and I try to stay as close to that program as close as possible to that program, because it's something I have to manage, and it's something that I deal with on a daily basis. Luckily, I don't have too many, strong desires, because of the work that I put in on myself, who I am, and to be constantly reminded of what it did to me and who it made me become. I didn't like that guy that I became, and I didn't realize that until I got sober and clean. And now that I can look back on that guy, I don't like that guy, and I don't want to be him again. So I'm trying to do everything I can to stay the person I am today, and which is continuing to evolve, to grow and to be better. Self-improvement is like my quest in life, is just to constantly seek improvement. And I don't, I knew when I was, living that life as an addict, that was not my motive.
And I completely agree with you because, that was something Tina and I talked about as we were working on the season about addiction and chronic illness. And I know there might be varying opinions on whether it is truly a chronic illness, but I totally agree with you in the fact that it ebbs and flows. I'm sure just like any other chronic illness, but I don't think people really understand, like, it really is a long-term work and action commitment, and it's not just I stopped and now I'm fine and I'm going to live the rest of my life and everything's great. That there is a long-term effect of that addiction.
Yeah, that's the hard part, right? Quitting's
Yeah.
easy. It's easy to stop. It's really hard to stay stopped, which reminds me, like I'm saying, like, quitting's easy. I've done it 1,000 times. It's like, well, that's the problem. You have to keep quitting because you keep going back to it. It's like, that's the hard part, is to stay stopped. So that's why it's important that I do these other things on a daily basis to maintain my recovery, to maintain my sobriety. And that's where I feel like my health issue that I've experienced has only magnified it all. It's only kind of given me more of a drive to do the things that is necessary to keep myself healthy.
I feel like that there's a lot of misconceptions about addiction as far as people putting labels on it, or people like not truly understanding. Like, when you see somebody who physically has a disability, you can see it. And I feel like with addiction, there's a lot of misconceptions out there, because if you have never experienced addiction in your family, then there's just a lot of things that people don't understand.
Yeah, and that's, a very common misconception. The thing that's frequently said is, like, we're not bad people trying to get good. We're sick people trying to get well.
Yeah.
And, a lot of people see it as, they see, because the thing about addiction is it changes who you are as a person. It changes your behaviors, things that you do. I did things that I would never thought I would do. Stealing money from my parents, like, and not like things that I'm ashamed of. I really am ashamed. And that's something that I have to live with. And, I go through the proper, steps to right those ships. But it just makes you act differently, behave differently, present yourself differently. And that's, people see that, and that's what they see, even because when you have health, and, for me, my health was like a brain thing. So it's kind of the same thing. People don't know what's going on. They can't see my illness. I don't have crutches on or a cast or anything like that. And, MS, same thing. People don't see what you're dealing with, or what you're going through, and what you're dealing with. And, that's the tough part about both of those, both, my health and my addiction stories, is like, it's not something that people can see with their eyes. But they see it through my behavior and things of that. And it changes my behavior. It's not who I am internally, who I want to be. Being an alcoholic isn't how often you drink or how much you drink. It's not the time of day you drink. It's when you put that first drink in you, it triggers an allergic reaction in your body, in your brain, that you can't stop, right? You think you can stop. I always thought I could stop. I could stop after a few beers if I wanted to, but I don't want to. When I get a few drinks in me, I don't want to. Well, that's the trigger. That's the reaction, the allergic reaction that's going on. I think I'm in control. I think I'm thinking that. I'm not thinking that, right? That's the allergic reaction that's going on in my brain. And it's convincing me that I'm thinking that, but it's not the reality of it. The reality is that once I put that alcohol in my body, it changes. It changes who I am and my thoughts. And that's the part that, like, I wanted to change in myself. It's like when I could sit down and, like, see what I was doing, and the people that get hurt the most are the people closest to you, my loved ones. my family, my parents, my siblings, um, my wife, those are the people that got hurt the most. And, that's what I wanted to change. So that was a big contributing factor in me wanting to get sober.
Struggling with addiction can feel overwhelming, but you're not alone. Help is available.
Whether it's therapy, support groups, or medical treatment, recovery is possible, and it starts with reaching out.
If you or someone you love is facing addiction, call the SAM HSA helpline at 1-800-662-HELP for free, confidential support 24/7.
There's hope, there's help.
And recovery is possible.
You are not alone.
Sometimes those with addiction, they're very high functioning. Like you may not even be able to tell that they're struggling or that they're on something, or they have that addiction. So what are some of the signs that you feel kind of early warning signs that somebody may be struggling with an addiction?
Yeah, I would say I thought I was very high functioning addict at the time. I didn't admit I was an addict. I thought I had it in control. I got this. I could stop if I wanted to stop until I tried to stop. And then I was like, well, I'll just do it again and I'll stop tomorrow, and every day was, I'll stop tomorrow. And, I was playing professional lacrosse as an addict. I remember, I'll share this anecdote, like being at halftime of a professional game and like not being able to get through it because I felt I was going through physical withdrawal and I needed something in my body to stop the withdrawal. So I would go into the locker room and I would be doing a pill in the bathroom and at halftime in the locker room, just to go out just to make it through the second half of the game. So, that kind of, showcases a little bit of like the severe extent of what I was going through. Yeah. So some of the warning signs, obviously behavior changes, right? If they're starting to act, differently, things, that the way they would normally act. If there's a sudden weight gain or weight loss, I gained a lot of weight, when I was going through my addiction, financial dependency or always needing money from people. I personally did not do that, but that's only because I had other means, of getting money, that again, I'm not proud of. So, emotionally, if they're erratic, manic, whether they're extremely anger or go to different extremes, whether they become very depressed, which I would when I was going through withdrawal. I would become very depressed, and then I'd be the opposite end of the spectrum, very elateful and happy when I was on it. So like any kind of massive mood swings, that's definitely a sign. And then there's like physical signs, in my case, my eyes would become very dilated. Some people's eyes become bloodshot. Like those are some physical signs, on top of like the weight loss, weight gain. So like things like that you can kind of pick up, but at the same time, it can go very undetected. It can be very hard to diagnose or to like, notice somebody who is going through an addiction, which is how I felt I was. I thought I was hiding it really well. And I did to a certain point. But like I said in my story, like when I got caught at my football game and it, exposed it to my family, like, yeah, I've been dealing with this issue, that put them on alert to keep an eye out. And then they started paying closer attention to my behaviors and stuff. And months later, when they're like, yeah, they could see that, I was reverting back to those same behaviors. That's when they had the intervention for me, which was, again, an absolute blessing that they did, and extremely grateful that, I had the family to do that for me.
I don't know, it's the way my brain works, but I just did a little Google research because I'm wondering how much addiction is tied to a surgery or something like that, where you're given those opioids to control your pain, and then that leads to an addiction. And what I found out here is that surgeries have a 44% increased risk of long-term opioid use. That's just interesting because I wonder these medicines that are supposed to help you get through those painful few days of a dentist or a surgery, that it can lead to like a long-term road to addiction. That, I mean, that's a little bit scary.
And that's why I was so petrified when they were giving me medication after my original surgery. Because I didn't know the stat. I didn't know the numbers attached to it, but I know people personally. I've heard countless stories of people becoming addicted because of some kind of medical procedure they had. They're prescribed medication, and then that's what was the catalyst for them to kind of lead into a long-term addiction. So that's what was one of my biggest fears, on not only my original surgery, but the surgeries, you know, all the preceding surgeries that I had to go through. So when I went on my medications post surgery, like my parents would monitor it, they would give it to me as prescribed, you know. And listen, I had no desire, thank God, I had no desire to continue. I never had that mental, you know, switch back to that old mindset where I wanted to do it. Um, but at the same time, I had to be very careful because actually the last surgeries, which I just celebrated a year, I had a back surgery and a brain surgery within 6 days of each other. So I was in a lot of pain. And when you take this medication, you know, for the purpose of pain reduction, it's a miracle drug. It really is. It works. But since I had those two back-to-back surgeries so quickly, I was on medication for almost a month. And like I was mentally fine, but my body, I ran out. My body started going through withdrawal, and that scared the heck out of me. So I immediately addressed it with my doctor. I was going to do a taper, you know, like very quick taper because, you know, you're going through physical stuff. You don't want to like put your body through too much physical stress. And, you know, she kind of guided me a little bit better, much less aggressive than I wanted to. But I ended up getting off of it and, you know, not having any issues, you know, thank God, since. But yeah, that's definitely something that happens more often than I would like to admit.
How do you feel that mental health support can help in recovering from an addiction?
I mean, that, in my opinion, is addiction. It's a mental health issue. So you have to treat yourself as a mental, you know, health patient, uh, which again, when you change your perspective about things, like I changed, like my perspective was like, I'm a victim or this happened to me because of this and like pointing my finger, blaming others, why I am where I am. But as soon as you like take accountability and you kind of do some more self-reflection and you kind of work on that mental health, it kind of just really elevates you spiritually, you know, mentally, and you know, in my case, physically, you know, with the work I've put in. But you know, through support groups, you know, like I said, I go to recovery meetings, uh, you know, therapy. I've done therapy both for health and for mental health and for brain health. At each pivotal moment of my life, you know, I would get to a point and I'd have to make a decision. Like, what am I going to do about this? You know, like as soon as I can identify a problem, it's like, okay, now that I can recognize that there is a problem, this is the problem. I always just ask myself the simple question, well, what are you going to do about it? Like just talking to myself, what are you going to do about it? Right. And from there, it kind of leads me into a pathway of self-improvement. Whether it's, you know, through the addiction, getting better, you know, spiritually, mentally, physically, through my health, you know, learning to walk again, you know, getting myself physically in better shape and taking care of myself. You know, they've been catalyst points.
I wonder if there's a difference in people with addiction that have a strong family, a strong support system like you did,
Mm-hmm.
a more successful rate than somebody who's either hiding it or doesn't have the support in their family, friends, you know, spouses, things like that. So, do you feel like that having that support system in your family made your success rate go up a little bit?
there's no question it has. Because I know people who do not have that same type of support, and it's so much more difficult. And that's high on my gratitude list. That I try to practice on a daily basis is just remaining grateful, living in gratitude. But yeah, that's definitely been a huge benefit, to my success thus far, in both addiction recovery and my health recovery. My family, my loved ones, the support I've received from friends, um, my support network. It's tough because like I don't know how to put it. There's nothing I can say that really expresses how lucky I am. But yeah, that's definitely been huge in my success.
Mm-hmm. Yeah, I wish everybody had that support system.
Yeah, yeah.
How can you support people going through addiction without enabling them?
Something that, thank God, and I pray that I don't ever have to like go through this with my own children. But like if I had a loved one that was going through an addiction, first thing people should do is like educate yourself, right? Is like learn more about the addiction and what that person is going through, physically, and what's going on in their body and their brains, driving their behavioral changes. And then the part that I see like is most detrimental that most people do. Like if I had a child going through it, like if they needed something, I want to give it to them. I want to support them. I want to help them. But like if you're financially helping them, you're hurting them. So like to not do that must be like the hardest thing in the world to do, but it's such a necessity to not give them what they want because they think they know what they want. I thought I knew what I wanted, but that's not what I really wanted. That's not what was best for me. So I think like as a loved one, like to kind of recognize, you know, first of all, learn about what they're going through, recognize those behaviors, and like not to support them emotionally, but not financially, I think is an important concept that people need to understand.
You said earlier that you either had told your family or that you were like, I got it under control.
Hmm.
So what's some advice for people that maybe suspect it or maybe even confront somebody and they say, oh, I've got it under control?
Don't believe them.
Yeah.
No, it's and I can only speak from my experience. Some people may be able to get it under control. I wasn't able to. Um, Most people I know, or most stories that I hear, if not all of them, they can't. The drug is too powerful. It's way more powerful than my willpower, that's for sure. And anybody else's that I've heard, I've never heard of anybody just doing it on their own. Now, treatment can be different. You don't have to do recovery programs. You can find other ways. You can find through religious or spiritual or, physical, whatever, treatment option you want to pursue, you can. But to just cold turkey stop and to stay stopped is extremely difficult. So I would just be on high alert if somebody in my situation, like in my situation, who gets caught or gets, it comes to light, you know, to just stay on high alert to make sure that they're doing the things that they say they're doing.
Mm-hmm.
Advice for those that have a loved one struggling with addiction, that they have kind of reached this point of going, okay, I can't keep emotionally going back and forth with this. They're doing well, they're not doing well, they're doing well, they're not doing well. We're trying to encourage them to go into recovery, to want to overcome it, and that person just, I know you have to be ready you have to be ready to go through it, and that also can be very emotionally taxing for those that are trying to support them.
Yeah, I wish I had a better answer for you, but like you said, they have to be willing and ready. to make the change. So there's no, golden answer that I can give to say, hey, you do this and you can get them sober or clean or whatever it is. Uh, they have to reach a point where, staying the same, they have more fear of staying the same than changing, right? And I think that's an internal thing. Now, if they come to, get some clarity, uh, you know, physically, spiritually, mentally, hopefully they can, kind of run with it that way. But, I know people who go in and out, right? Get recover, relapse. And that's just an unfortunate cycle that most people go through. And I wish I had an answer. If I did, I'd be a millionaire because I would solve a lot of problems.
Yeah.
Right. You need support. You can't do it on your own. I certainly did not do it on my own. Right. I have a strong support network. I have a sponsor. I have a great network of people that I consistently speak with, surround myself with. Um, to have positive influences on my life. And when I have these life situations or life decisions that I need to make, I do not make them on my own. I've learned many, many times over that the worst person to make a decision for myself is myself. I got to bounce this off of multiple people before making any, major life decisions. So I would highly encourage that, to kind of build up your network and make sure you're surrounding yourself with the right people.
Thank you so much. I really do appreciate it.
No, I really appreciate it as well. Thank you.
What a great conversation. I'm so glad that Bill was able to join us today. But let's bring our Spoonie in, Lauren, to talk about her Conradi-Hunermann Syndrome. Welcome, Lauren, to the Spoonful of Strength podcast. We're really happy to have you on today to talk about your Conradi-Hunermann Syndrome. Did I pronounce that right?
Close, Conradi-Hünermann.
Okay. All right. Well, how are you doing today?
I'm doing well, thanks. Happy to be here.
Oh, great, great. We ask that you start out just by telling us a little bit about yourself and where you're from and anything that you might want to share for our listeners.
Of course. So my name's Lauren Schoeller. I'm currently living in Boston. I grew up in New Hampshire in a small town. Um, I did my undergraduate degree in New Hampshire, and then I moved to Boston for grad school, and now I'm working at one of the hospitals there, and just loving the city life. I always knew as a kid that I wanted to live in Boston, so it's been really fun. I've been here for a few years. And, as you mentioned, I have Conradi-Hunermann syndrome, and that is a form of dwarfism that causes many musculoskeletal differences and affects other, body systems, including my eyes and my hearing, my hair, my skin. And we can get a little bit more into my journey with that shortly, but really it was my experiences growing up with this disease and my interactions with my medical teams that inspired me to want to pursue a career in healthcare. And so I worked in clinical research before my position that I'm in now. Now I'm a clinical assistant and I'm working on applying to medical school this upcoming cycle. And it really just all of those experiences, both the good and the bad, you learn something from everything. And that's really what motivated me to get involved with that. Outside of my professional life, I'm now training for a triathlon, which is like huge to be able to say because over the years my mobility has been challenged and it was hard to really envision what my life could look like in terms of being active and doing the things that I really once enjoyed doing as a kid. And so now on my days off or after work, I spend it in the gym, at the pool, and I'm just like doing all these cool, fun things to move my body and enjoy that movement. So that's a little bit about me and where I'm at now.
What is your target of the triathlon? Do you already have one on your radar?
I do, yeah. It's June 7th, in Hyannis, Massachusetts on the coast. Um, I have never been down there. From, what I've seen, it looks like a beautiful kind of coastal race. And it's a sprint triathlon that I'm doing. So it's a shorter distance than there's sprint and Olympic distance. I figure I'll start with a safer sprint triathlon and see how that goes, and then maybe later I'll dabble into like Olympic distance. So it's like a quarter mile swim, a 10-mile bike, and then a 5K run. So I
Wow,
think that'll be enough to push my body and to, be able to celebrate that, that
that's
ability.
great. That's
Yeah.
great. So this condition, the Conradi-Hunermann, um, so this is a genetic condition. So this is something that you were born with. And from my understanding, it's very rare, maybe 1 in 200,000 is kind of what I was seeing. So can you walk us through like the when you were born and the things that happened early on to get this diagnosis?
Definitely. Yeah, the National Organization for Rare Disorders cites its incidence around 1 in 100,000 to 1 in 200,000 individuals. When I was born, it was interesting because my mom was diagnosed with the same genetic condition when I was born, because mine presented, more severely. And also, medical technology changed, and advancements changed so much from when my mom was born to when I was born. So there was, a bit more awareness and understanding of it. Um, when I was born, it was immediately evident that my left leg was significantly shorter than my right leg, and my left arm was shorter than my right arm. I also had some a condition with my skin called ichthyosis, which typically with this condition it'll present more severely as a baby, and then as you go through infancy and early childhood, the ichthyosis will tend to resolve or at least improve. Um, and so there were, some of those signs. Also, just like the structure of my face, there are characteristic craniofacial differences associated with this condition, that were, particularly evident when I was born. Yeah, I think one thing that was interesting about, being born when I was, I guess, was there wasn't a genetic test available for Conradi-Hunermann syndrome at that time. So when I was born, they said that I likely had this condition, but they couldn't say for sure until around maybe I was 5 or 6 years old when we had access to the genetic test. But another thing that kind of like played into it was that I am a quadruplet, and so four of us were born at the same time. There we were born prematurely, and so there was the focus was mainly on getting us in stable condition. We spent the first 2 months in the NICU, and luckily we're all doing well now. But certainly in those early days, the focus wasn't trying to understand everything about this rare disease. It was more about making sure that we were healthy and that we were going to be able to thrive in the condition that we were in. So my twin sister also has the condition. The quadruplet set is two boys and two girls. And just because of the genetics of it, my brothers don't have it. It tends to be highly fatal in males. Oftentimes, the mutation is so severe that they wouldn't make it to birth, or they oftentimes would pass away, before the age of 2. So my brothers don't have it. My mom, my sister, and I are confirmed to have it, and kind of up in the air as to whether my older sister has it. Trying to advocate for better access to genetic testing for siblings of individuals with rare diseases, because that's something that's not currently widely covered by insurance companies.
How I even just being born as a premature baby, as a single premature baby, you tend to stay in the hospital for a really long time. How long was it after you were born and your siblings were born before you were able to come back home?
I think I was one of the first of us to go home, and it was maybe a month and a half for me. The My sibling that was in the NICU the longest was 2 months in the hospital, and it was very up and down during those times. We each had periods of time when we were very sick, and when we required a lot more support. Most of us went home on oxygen, and we had a lot of home health needs even after we got out of the NICU and we were discharged home. But it was about, I would say, about 2 months for us in the hospital.
And you said it was a few years before you actually had the genetic test done to confirm it. So in those first couple years, were there any treatments or anything that they did? Did they automatically assume you had it until they did the genetic testing, or was it kind of a wait and see?
Yeah, I believe the characteristics that I had were strong enough where they felt like pretty confident that that was the condition that I had. In terms of treatment, because the majority of the um, affects our musculoskeletal. It was a lot of waiting and watching until I got to be, around 2 years old and starting to walk and, really seeing how it was going to continue to affect my body as I grew. So, when I was maybe 1.5, 2 years old was when I like first started getting followed by an orthopedic specialist. We started with a spine specialist because Conradi-Hunermann syndrome also, it can oftentimes cause scoliosis, and so that's one of the, which is a curvature in the spine, and so that's one of the conditions that they tend to like to try to monitor early on. So I started seeing a spine specialist, and then when it got to be time to, start walking, I ended up needing a lift built on the bottom of my shoe to accommodate my limb length difference so that I could walk more naturally. And so at that time, my spine specialist referred me to a lower extremity orthopedic specialist. And that was really like one of the more pivotal points in my care, actually, was my first appointment with this lower extremity doctor, because my parents brought me to that appointment, and this doctor was adamant that amputation was the only option for my leg length discrepancy. And they said that this doctor just presented it in such a cold way. They were completely blindsided by it. They didn't expect that to be a conversation in this appointment at all. And so, I feel very blessed that they advocated for a second opinion, and they brought me to another hospital, which is the hospital that I have received care at for the last 24 years. And the doctor that we saw there said that amputation absolutely wasn't necessary and that I was a good candidate for limb lengthening surgery. And so that kind of started me on a pathway towards limb lengthening, and that's been a big piece in restoring my mobility over the years. Because of the extent of my limb length difference, it ended up being 3 surgeries to lengthen my leg. One of them was when I was 7 years old, and then we waited for me to grow a little bit more. So when I was 14, I had the second one, and then in college, I had the third one. And so we did it in phases, and I think that I am very blessed with the medical team that I ended up with, because they have continuously fought to keep me on my feet and to do everything that they can to avoid some of those drastic measures that were that were mentioned in early on in my care.
Hi, this is Rachel from Spoonful of Strength. My Etsy shop is a chronic illness-owned business where I design t-shirts, hoodies, mugs, magnets, and more, all with a focus on chronic illness empowerment. Whether you're looking for something cozy, funny, or inspiring, I've got you covered. I also take custom orders because your story deserves to shine. Visit spoonfulofstrength.etsy.com, that's spoonful with 2 L's, and enjoy 25% off your order with the code podcast at checkout. Let's wear our strength with pride, one design at a time.
What was the recovery time for those surgeries?
So the first 2 leg lengthening surgeries that I had, we used an external fixator, which is like a metal apparatus it has pins that are drilled into your bone, and so the procedure starts by they need to surgically break the bone in order to lengthen it. And so that initial recovery in the hospital was probably 4 or 5 days. Admitted in the hospital, and those early days are getting used to having like an apparatus, an external fixator like that attached to your body. um in the hospital they taught us how to do pin care for the pins that were in my leg, and they teach you how to lengthen the device at home. um Overall, the first lengthening that we did was we lengthened about 2.5 inches. And so there's kind of an algorithm for like, for every inch that you lengthen, you spend X amount of time after that healing the bone. And so all of the time that you spend healing the bone, you're non-weight bearing through that leg. And so because we did 2.5 inches of lengthening, which took a little, maybe 2 months total of like actively lengthening it. And then it was, I want to say 4 to 6 months. I should have gone back and like looked at the timeline a little bit better, but maybe 4 to 6 months after that of like continuing to heal the bone. So I was on crutches and used a wheelchair a lot during that time for support. And also with one of my limb lengthenings, my bone just healed so poorly, and I had the fixator on for over a year. It was like a year and 2 months, and we were still trying to get the bone to heal at that point. So, definitely a long process, and it's not without complications. But looking at the way that now I can stand strong thanks to those limb lengthening surgeries, despite it being such a long process, it certainly feels worth it.
Mm-hmm. Do you ever think about, I know you're a rare disease advocate, and do you ever think about how life would be had your parents listened to that first orthopedic surgeon? And do you feel like you kind of got that advocacy trait from your parents for kind of sticking up and going for that second opinion?
Absolutely. I mean, my parents fought so hard for me to get the best care. And so that was always instilled in me, like from a young age. I don't think I really became like an active advocate until I was in high school, because I kind of I let my parents do a lot of it for a little bit too long. But they were such strong advocates for me. And I certainly do. There have been times, especially in high school, like when my chronic pain in my leg got, pretty bad. And even last year, I had a pretty significant, issue with dealing with pain in that leg. And so there have been times when that has kind of forced me to think about, um, you know, would I be in that level of pain if my parents hadn't pursued limb lengthening versus amputation? But ultimately, they made the best decision they could at the time with the information that they had, and so we don't have any regrets about it. And even now I can sit here today and I can say that I am happy with the decision that they made. I certainly don't regret that. But there have been periods of time, different seasons of life when the pain has been worse, and I would think, wow, maybe now is the time to amputate my leg. I thought about that last year when I was just in severe pain every day. Luckily, we found a device for my leg that helps to manage that pain. But I think it's always something that will be in the back of my mind, whether it's in a positive way or a negative way. And right now, I can look back positively and say that, I'm confident that they chose the right path for me at the time.
Mhm.
I'm sure that was a tough decision. But again, that's one thing that we talk about a lot, about being your own advocate or having people that can advocate for you versus just taking that first answer and that first recommendation. Now, you mentioned that your arm and leg both were affected. I'm assuming limb lengthening, that's just the leg in order to be able to to be able to walk evenly, correct?
So I had three leg lengthenings and I did do one lengthening on my arm. My arms are still not there was about a oh gosh, probably close to 6 inch length difference in my two arms. And so we lengthened about half of that. So my arms are closer in length. They'll never be fully equal, but just because of how much of a difference there was, it did impact me functionally, and so we decided to make up some of the difference, and that took place a few years ago.
Yeah. You mentioned a little bit earlier about being in school. How was it going through elementary school and middle school and high school and having to deal with all the surgeries and being out of school, but also dealing with having to use mobility aids while also being in school?
Yeah, I mean, it was a lot to navigate for sure. My first surgery when I was 5 years old, I ended up having some tutoring at home, to make up for the time that I missed from school. And, I think a big component of it was like the social impact of going to school with, I went back to school with a full body cast at times and with these external fixators that most kids have never seen. And, it's possible that they'll never see them again, because you just don't encounter them that often. So it was definitely really difficult going back to school and especially in elementary school. I don't know that my classmates always knew how to ask questions or they're very curious, as any child would be, and that's understandable. But I think sometimes, like, that curiosity, they don't necessarily know how to ask questions most appropriately. And so oftentimes it came off in kind of a harsh and mean way of them just trying to understand what they were seeing. Um, so I think there was certainly some level of bullying, from kids who I don't think they were curious. I think they saw that something was different and they wanted to point it out too. Um, I do, when I look back on elementary school and middle school, my siblings were also the same age as me, and I had an older sister who was just 2 years older than me, so she was oftentimes in the same school system. And they were like my best buddies throughout school. Any time at recess when I would go out in my wheelchair, one of them would always be by my side to make sure I was safe. And, I think we really bonded over that. Because there were a lot of things that I couldn't do. And it was very clear that it was very clear that I was different from a young age. There were not any other kids in my grade who went to school in a wheelchair or who had these massive casts and had, these very clear mobility challenges. And so I definitely I felt like there were a lot of eyes on me because of that and not necessarily in a good light. Um, so, that social aspect was huge, and I think it certainly informed some of my later recoveries where I would try to schedule them for like summer vacation when I wouldn't necessarily be at school in the midst of a recovery. Um, and my surgeons were always amazing at asking me how I was doing at school, if I felt like, I was being included and how I was coping with that aspect of it, which I think is so important. And I'm, grateful that they checked in that way because the mental health aspect of going through these rare and difficult things is real. And so for them to acknowledge that even at a young age and to make sure that I was taking care of myself was really cool.
Do you feel during the school years that you had support from the teachers and the administrators, or do you feel like they could have done a little, perhaps stepped up a little more as of navigating that process
For
and
the
helping the other kids understand?
For the most part, I was really impressed with how they handled it. Before most of my surgeries, like the school nurse would be in touch with my mom or I to try to understand what it would look like for me to return back to school safely. Something that I thought was really awesome was after some of my surgeries, my teacher would kind of like share pictures with the class of like with my permission, but of like my time in the hospital and especially when I was going back with an external fixator, my teachers would show my classmates, when Lauren comes back, this is what will be on her leg and she'll be using a wheelchair and like things will look different. And they explained why. And I think during one of my surgeries as well, when I went back to school, one of my teachers even allowed me to like kind of get up in front of the class and talk about what I was comfortable about, and to talk about what I had been through and kind of how long I would have the device on my leg and just like allowing creating a safe space for classmates to like ask questions to me or to ask questions to the teacher. Um, I think that was I think about that and it just feels very inclusive and trying to educate my classmates on what they were going to be seeing and creating an opportunity for them to share any concerns or ask any questions about it, which I thought that was like huge for even my level of comfort going back to school, knowing that my classmates knew a little bit about what they were going to be seeing rather than just showing up with, these rather crazy looking devices and I didn't have to worry about being berated with questions because they had already handled that before I got there.
That's great. I'm sure that made a big difference. Can you walk us through the multisystemic implications related to this condition? What else you have to deal with kind of on a day-to-day basis?
Yeah, so there are other musculoskeletal implications. I mentioned scoliosis and limb length discrepancies. I also have hip dysplasia and a foot ankle deformity. Um, it also, because of the scoliosis, tethered spinal cords can be associated with scoliosis and with genetic skeletal dysplasias like this one. So I have a tethered spinal cord. Um, it impacts my vision. I have a condition called a nystagmus, which causes my eyes to involuntarily shake in certain, situations. It's worse when I'm like I don't drive right now. I don't have my license because we're trying to navigate like how can I safely drive, especially at night. Like walking in the dark is something that exacerbates my nystagmus. Um, so that's something that we're continuing to try to figure out. I also have mild hearing loss related to my condition and the ichthyosis that I mentioned that oftentimes it either resolves or it greatly improves after infancy, but my left leg has, it still has the ichthyosis like pretty moderately and so especially where I wear a mobility device on my left leg, anytime you wear like a cast or a brace, you always want to, look for skin breakdown and ways that the brace might be irritating the skin. And so because my skin is already more fragile on that leg, it's just like another level to consider making sure that my leg brace like fits me properly and that it's not leading to skin breakdown because my skin is more fragile due to the ichthyosis. So, in terms of my everyday, I think like the vision aspect certainly, impacts me a great deal. Um, the hearing has been well managed with I wear hearing aids when I know that I'm going to be somewhere where there might be a lot of background noise or things like that. Um, and then, musculoskeletally, I do have chronic pain in my back and my neck and my shoulder. Um, the pain in my lower extremities, luckily, since getting the latest brace for my leg, I can walk with no pain. I work 10-hour shifts and so it's long days on my feet. And now if I looked back 6 months ago, my ability to get through a workday looked a lot different than it does now. So now I can get through a full shift without pain in my hips and my leg. And it's really just managing the back and neck and the other conditions that are associated with Conradi.
Why don't you share with us a little bit about the podcast and how that came about?
Yeah, I recently started a podcast called the Patient Perspectives Podcast, and was really motivated by my interactions again with my medical teams, and I think they have truly exemplified what patient-centered care means, and putting the patient first and really understanding patients' goals and values in their treatment. Um, that's something that I've really appreciated about the care that I've received. And this past October, I went to a medical conference that was focused on hip preservation. And they had actually invited a hip dysplasia advocacy group that I work with. They invited some of our board members to go and talk about patient-centered participatory care and the importance of peer mentors for individuals going through hip dysplasia treatment. And, I had been to multiple other medical conferences before when I worked in clinical research, and I had never seen such a focus on the patient, or really on the patient perspective. And I thought it was so neat that they, wanted to invite patient advocates to share their story and to share their perspective because that's such, valuable insight for medical professionals to really understand what it's like to be a patient. And so after that conference, I was, just really thinking about, the way that they highlighted the patient perspective and the ways that in my care I have I know what it feels like to have medical team members who do really focus on patient-centered care and also, some of the more negative experiences that I've had with medical professionals to know like what is important to patients and how can these positive or negative interactions leave patients feeling after an appointment. So with all of like those ideas circling around, I decided to make this podcast where I highlight patient voices and patient experiences specifically around patient-centered care and really understanding what is important to patients in their journeys in their healthcare because how can healthcare providers really know what patient-centered care means if they don't hear that from patients themselves and and what's important to us. So that really fueled my motivation to start that podcast. And I've done about 6 episodes so far. It's been really fun to get to connect with other patients and advocates and just sharing such powerful experiences that I think can be beneficial for patients to hear to, possibly give them more confidence to have a voice in, during their treatments. But also for medical professionals to hear, again, to really understand what's important to patients in their care.
So important. I really like that viewpoint of trying to get that perspective from the patient. And I had the opportunity to sit down with you a couple days ago, and so I got to experience a little bit of it. And I loved your questions, and I loved the idea, the viewpoint that you've got with that podcast.
Over the years, do you feel that the medical field in general is starting to become more open or more aware of that the need for patient-centered care?
I do. I really do. And as I mentioned, it was a pretty big topic at this hip preservation conference that I went to last fall. I think with the help of patient-driven advocacy groups, that message is getting out even more. Um, when I did my master's degree at Tufts and worked closely with like the medical school faculty, and I was really impressed with their focus on a holistic approach to health care and really emphasizing that there's a human being that you're caring for. It's not just a patient. It's not just, a number on a list. Um, and they allowed me to do a presentation on my genetic disease. And they were really welcoming of the idea of also just sharing my experiences as a patient rather than just like the science behind my disease. I also, shared what my journey has looked like and what I have learned as a patient. And so I think there's been a lot of progress in that regard in terms of medical school curriculum and also, just doctors and medical professionals being more aware that um, patient-centered care is it's very beneficial for patients, and I think it leads to better outcomes because it's just more of a human and like holistic approach to caring for what can sometimes be complex conditions, and that requires a larger view, and it's important to consider the emotional aspect of being a patient, the mental aspect, the social aspect, all of these things that I do believe have gotten more recognition over the years, which is exciting. And there is more work to be done, but I think there are a lot of people who are willing to put that work in. So it's good to see.
So, what would be a piece of advice or some advice for people who have rare diseases that they may end up going to a doctor that doesn't even know much about the illness? So kind of in closing here, what's some advice that you would give to somebody with a rare disorder to kind of navigate that journey?
Yeah. I mean, my advice is to be prepared going into appointments. If you feel comfortable kind of being an educator on your condition. My doctors have, for the most part, have always been like very receptive to learning as we go, and they recognize that they don't know everything about my genetic condition, and I don't know everything about my genetic condition, but together we can know a lot. And so when I go to my appointments, especially if I'm meeting with a new doctor, I bring information from like the National Organization for Rare Disorders. I bring, information from their website about my condition, and just kind of lay it out pretty clearly what my medical history has been, what my surgical history has been, and I make sure that they are willing to like partner with me to understand my condition. I'm not afraid to reach out to a second, third, fourth doctor until I find one that I know is willing to navigate this journey with me. And so, advice to anyone in the rare disease community is to seek those second, third opinions until you find a team that you're most comfortable with. And also, if you're comfortable with it, kind of be an educator on what you know about your disease, because I'm sure, especially in the rare disease space, these doctors may have gotten one lecture on the condition in medical school, and they may not have seen it in their practice since. And so to be able to say that, I don't know everything about my disease, but I do know a lot of I know how it feels to live with my disease, and that's an important perspective to share with doctors. And then also, there's a piece of I feel like sometimes even with my doctors that I've known for years, we're still learning about my condition together. Um, and so my ultimate advice, I think, is to find a doctor who's willing to be a partner in your care. And again, that kind of just embodies that patient-centered care and really allows you to be part of the shared decision-making um, process.
Wonderful. Can you tell us where you can find the podcast?
It's on Spotify and YouTube right now. I may be expanding it out to Apple Podcasts. But as of right now, if you want to, I have a video component of it on YouTube. So if you are more of a visual person, you can watch it there, or listen to it on Spotify. New episodes release every Sunday at 8 a.m. Eastern Standard Time. And I also have an Instagram where I post clips from each episode and kind of introduce new guests coming up. And so I try to make that pretty interactive. So you can find me on Instagram, Spotify, and YouTube.
It's so wonderful to have you on, Lauren, just to
Yeah.
For this to be something we are not familiar with, and just to kind of educate us on the Conradi-Hunermann Syndrome and spread awareness and advocacy for rare diseases. So I can't thank you enough for coming on tonight and sharing your story.
Yeah, thank you so much for the opportunity. I think especially in the rare disease space. I will say we're recording this in February, which at the end of the month is Rare Disease Day, February 28th. So definitely an important month for awareness, and I appreciate the opportunity to bring awareness to my condition. And also, I wanted to say I really love what you two have done with the Spoonful um, podcast and your Instagram to really bring together the chronic illness and rare disease community. It's really great to see uh, people like you, advocates, to bring more awareness to these conditions and to create community.
Thank you.
Thank
That's
you.
awesome.
Oh my gosh, she's such an amazing person and so inspiring.
Yeah. Yeah. A condition I have never heard of. And I didn't realize that something in the umbrella of dwarfism would have so many other multiskeletal symptoms, that it would affect so much of her vision and her hearing and all of that. It's, she's just wonderful, and she knows her stuff. And I love how she advocates for the rare disease community.
You just hit the nail right on the head as far as the dwarfism and those rare disorders. It's so much more than just what you see visually.
Mm-hmm. Yeah, definitely. Another great Spoonie, and we've got so many more this season. Next week, we're going to talk about, in part one, Tina and I are going to talk about using music as medicine. I am somebody who music speaks to me, and I have different playlists as depending on, the mood I'm in or how I'm feeling mentally. And so we're going to talk a little about how music can be healing with chronic illness. In the second part of our episode, we're going to bring on Karis, and Karis is joining us from UK. And she is going to talk about her muscular dystrophy. And so we're really excited to have her on from across the pond. And we are hoping that you have a great week and look forward to talking with you next Tuesday on Spoonful of Strength. Take care. Thanks for tuning in to this episode of Spoonful of Strength. We hope that you found a little inspiration and maybe even a new perspective to carry with you.
If you enjoyed today's episode, don't forget to hit that like button, follow us for more, and leave a comment. We'd love to hear your thoughts.
And if you're feeling generous, please take a moment to rate and review the podcast. Your support helps us reach more Spoonies just like you.
Until next time, remember to take care of yourself and keep finding strength in your story. Bye for now.
And see you next time on Spoonful of Strength.